On episode 4 of Silent Podcast, we meet with Dr. Ify Osunkwo.
I've always wanted to help people who were underrepresented and under-resourced and people who didn't have an advocate. So I tell folks, I said, you need help. Do you have somebody who's going to fight for you? If not, then I have your back and I'll fight on your behalf. So that's kind of like my life's motto.
Welcome to the Silent Podcast, where our focus is to strike out the silenced voices of those affected by sickle cell disease. We believe that by creating a platform to talk about real-life situations through the lens of sickle cell, we can change the stigma one voice at a time. Each episode, we will feature individuals who are changing the narrative of sickle cell. We hope that by sharing these stories, this podcast will inspire not only those living with the disease, but anybody that's listening to boldly persevere, confidently speak their truth, and courageously follow their dreams.
Hi, everyone. Welcome to episode 4 of the Silent Podcast. I'm Ijeoma and
And I'm Christina. And we are so excited about today's podcast. Today, as you're hearing this podcast, as it's released, it is September. And September is Sickle Cell Awareness Month. And we could not have chosen a better guest for this month's podcast. We had an opportunity today to speak to Dr. Ify Osunkwo. And I hope I said her name right. Ijeoma.
You know, I'm the worst Nigerian to ask how to say a Nigerian name. I'm sorry. But I believe that you said it correctly. But I wanted to interrupt. Not only is September Sickle Cell Awareness Month, but it's also Christina's birthday. So
true.
She's having a birthday September 3rd. So we wanted to wish her a happy birthday.
Oh, thank you.
You're welcome.
Oh. Okay, so anyway, today we have titled the episode The Voice, and that title is so relevant to everything that we heard Dr. Ify talk about today. But before we get into that, let's hear our voice of truth from Ijeoma.
I'm so excited about today's voice of truth. It really speaks to today's episode, and it's by Rumi. It basically goes, there is a voice that doesn't use words. Listen. Like, how real is that?
That is so real. When I hear that quote, I think about empathy, because a lot of times people who are empathic or who can empathize with others, they can hear what people are saying even when they're not saying it. And I saw that quality in Dr. Ify. In fact, that kind of brings me into like one of my favorite parts about today's podcast was when Dr. Ify was talking about how she learns who her patients are so that she understands what they're saying even when they're not saying it. And I was like, whoa, if other doctors and other professionals who serve others could learn that trait, how powerful would that be?
Right. And so that's why I feel like it's so powerful, because we do have a voice without words, right? In certain things that we do. And that's part of the title of this podcast in general, is silent. There's so many ways that people speak to you through their actions, through things that they do, to ways that they express themselves within the community. And so being able to hear a voice in the silence is really important. And so part of what I really appreciated about Dr. Ify goes back to what you said, is the fact that she took it upon herself to learn. She said it took her, over 20 years to get to the point that she is now. And the fact that it took her 20 years to really gain an understanding of how to address and how to interact with her patients says a lot. And so I don't want to speak too much into it, because I want to give y'all a chance to listen and to receive and to gain your own insight.
I think you'll be excited to know that you have an opportunity to, Dr. Ify speaks really well to explain what sickle cell is in this episode. So for those of you who are still learning about what sickle cell is, I think she had a really good explanation for you.
So I'm excited about that. And if you notice, me and Christina have on our boat, Live for Sickle Cell. So We just wanted to be able to show our support this month. And some of y'all may not notice because clearly you're listening to the podcast. But if you don't, me and Christina both have on a red lip to show our solidarity for individuals living with sickle cell. And so during the month of September, if you are able to show your support as well by wearing your red lip too.
Yeah. My lip is reddish for those of you who are listening.
Yeah, because her lipstick is empty. She was scraping to the bottom.
Hey, but anything for sickle cell.
But yeah, so let's go ahead and get into this podcast. We can't wait to share it with y'all. And please, let us know how you're enjoying this podcast. Share with us if there's topics that you'd like to hear about. Please feel free to reach out to us. You can reach out to us on Instagram at The Ruby Ball, on Twitter at The Ruby Ball, and at Facebook, The Ruby Ball Foundation, I think. I don't know. I'm not good with Facebook. So just hit me up on Instagram or on Twitter or on LinkedIn. And we'll be able to try to highlight those things that y'all are requesting. We want to try to do whatever we can in order to help enlighten everybody in the community, in the that living with sickle cell, or those of you that just want to learn more.
Mm-hmm. Yeah. All right. Here we go.
And here's a quick message from our sponsor.
All right, so we're back with Dr. Ify Osunkwo. Dr. Ify is a professor of medicine and pediatrics at Atrium Health and the director of sickle cell disease enterprise at Levine Cancer Institute in Charlotte, North Carolina, with 25 years of clinical and research experience in sickle cell disease and hematology. So welcome, Dr. Ify.
Thank you for having me.
Yes, everything speaks for itself. Well, yeah, thank you so much, Dr. Ify, for agreeing to be a part of this podcast with us. We are so excited. We just think back to 2 years ago when you were our keynote speaker for the Ruby Ball, and everybody was at awe at just how you were able to just break down sickle cell for those who have it and those who didn't have any understanding of what it was. So we're very excited to have you on as our guest today for sickle cell. So if you just give us a little bit about yourself, I know that bio just let us know that, look, you are the expert, right? So just wanted to start and what got you interested in sickle cell? What made you say, I want to dedicate my life's work to sickle cell?
Well, thank you, Christina and Ijeoma, for inviting me. And so what got me into doing sickle cell disease as my life work is really sitting at the feet of my mom. I think I mentioned it at the Ruby Ball. My mother is a nurse. She trained at Cornell University in New York City. And when I was a kid, we moved back to Nigeria when I was 7 years old. And she did a lot of public health education and awareness. And sickle cell was one of the things that she worked on. And we would go with her to the villages and the little parts of the town where we did a lot of education. And I remember she was talking to a group of mothers who had babies with sickle cell disease. And at that time, they would put the child's hands and feet in fire when they had a pain crisis as a way of casting out the spirit that caused sickle cell crisis.
Oh,
and,
my goodness.
Yeah, would get burns. And so she was teaching them how to dress the burns, and then how that is not not a spirit, that it really is sickle cell causing the hand and feet to be swollen and painful. And that was when I began to really love medicine. But that's when I began to really love, teaching, and also the having empathy for people with sickle cell disease because of how misunderstood the patients were as far back as in the late 70s, early 80s. And I think when you fast forward to my career in medicine, I've always wanted to help people who were underrepresented and under resourced, and people who didn't have an advocate. So I tell folks, I said, you need help. Do you have somebody who's going to fight for you? If not, then I have your back and I'll fight on your behalf. So that's kind of like my life's motto. So this is a population where it's a complicated disease. People don't understand it. People who have it don't have a lot of advocates. And, my mother's, lessons that I kind of learned at her feet, and just watching her, I'm like, I love this. I want to do this. And then, the next thing I know, here I am almost 30 something years later, doing sickle cell disease still. So it's been a lovely journey. I love, love, love my patients.
So how would you describe your journey as a sickle cell advocate in one word?
Oh boy. It's because one word is not going to be enough. Swimming upstream.
Yeah.
A passion. I thought about mission. One word, mission would be the word.
Nice.
This is not just a job. It's not just a career path. It's a mission. A mission to serve people who have no voice, have a voice that's not being heard, who are misunderstood, who are like a puzzle that needs to be solved, and really let them know that, with a little bit of time and attention and efforts, things can get better. We can help your pain. We can help your chronic organ disease. We can help what's going on with you. We can help educate people to take care of you better. So mission would be the word I would use.
Yeah, no, that's great. And so just even let's take it back because I know that we've been is this episode 4? Christina,
yes,
that we're on. So we're on episode 4 of this podcast. And when this releases, it's going to be Sickle Cell Awareness Month. And so we really want to be able to let people know what is sickle cell disease so that they have a better understanding of the base. So if you could just give us a little background on what sickle cell is.
So I'm going to start from the end and then kind of backtrack it to the beginning.
Okay.
So sickle cell disease is not, in 2020, a death sentence. I want people to hear that loud and clear. Today, I was in clinic and I saw a 79-year-old female.
Yes.
So it is not anymore a death sentence. So now go back all the way to the early, 1990s, 80s, and 70s. It used to be a death sentence. It used to be a genetic disease that if you had it, you do not live to be an adult. You died from infection, you died from organ damage really early in your life, or you died from a stroke. We've learned that it is a DNA mutation in your red blood cells. The DNA that kind of helps you make your red blood cells has a defect. And that causes your cells to not just be round like they're supposed to be. They become like a banana-shaped red blood cell. And so they don't work like they're supposed to. They don't work very efficiently. They don't carry oxygen down to the rest of your body like it's supposed to. And the cells are kind of weirdly shaped so they can get stuck as they're flowing through your body. So the combination of they get stuck and you don't get enough blood flow, and then they break apart a lot faster than they're supposed to, and that causes damage to your organs. Those two things lead you to have sickle cell complications that damage your organs and also cause pain. And so, yes, it used to be that you would expect 5-10 years of your life, maybe 20 years of your life. But in 2020, like I said, I had a 79-year-old today. And it was a good day. It was a good day.
That's great.
Sickle cell can cause pain. I mean, people think about sickle cell disease as a very painful disease, and that's one part of the disease. But it can also cause damage to your organs. And I want people to understand that just because the person doesn't have a lot of pain doesn't mean they don't need attention. Because they may have eye problems, lung problems, kidney problems, liver problems. They may have leg ulcers that are very, very, right? They may have hearing loss. It can make you go deaf. They can have a lot of dental problems where they have a lot of cracked teeth, bad teeth, teeth falling out. Every organ in the body can be affected by sickle cell. And so when you think about sickle cell disease, think about your entire life is affected in one way or the other. It's either going to be pain or organ damage, and whatever else is going on with you, it affects, can you go to work? Can you do school? Can you get a job? Can you get a boyfriend or a girlfriend? Can you get married and have kids? If you have kids, can you take care of your kids? Can you do your regular daily work like everybody else? So they need support. If nothing else is heard from today, is that every part of their lives are impacted and they need support from everybody to be able to succeed and thrive.
Yeah. No, and I like how you took that, because there was something that I recently posted, because I had to do a interview with the Sickle Cell Disease Association of America. There was a group, it was called Rare Mark. And so basically I shared my story. And so one of the things was, what does sickle cell look like? You know, like people, there's not one face to sickle cell. every sickle cell patient has things that affect them in different ways. So there's a different look, there's a different thing to everybody. Like people say like, oh, you don't look like you have sickle cell. And I'm just like, what am I supposed to look like to say that I have sickle cell? And so just even going back to the whole thing of in pain, because a lot of people, when they have sickle cell, because people think, oh, you look normal on a regular day, and then literally 2 minutes later, you're in excruciating pain. If your sickle cell does show itself in pain crisis more often, then it's just like, oh, you can't be in that much pain, or, oh, it's not that bad. And it's just like, you don't know like what it's dealing with. Just because it doesn't show on my face doesn't mean that it's not affecting me internally. So same thing, like I was talking with Bethany, and so a lot of the issues that she's had through her sickle cell, and so Bethany was the other speaker at the Revolve. She'll also be joining us for one of these podcasts coming up. But a lot of the things that she's had have been very similar to mine. So just when it comes to having gallbladder issues. And so it's like, I had to get my gallbladder removed, and I was wondering, I'm like, I don't have issues in terms of like, I eat healthy. I'm like, I don't have issues from that, but I'm like, no, that's not why you had to get your gallbladder removed. Right. And so they're like, it's blood deposit stones. There's different things that would cause this to be an issue for somebody with sickle cell. On top of that, or whatever, like I've had blood clots or whatever, and I've had pulmonary embolism has been issues for me through my life, but people wouldn't see those things just looking at me. And so it's just really having that understanding that it's different for different people. And then same thing, like I have a friend who had issues with their spleen. And so like, I know people who don't have a spleen. I don't have a spleen. And I didn't even know that until I was at the hospital one time, and they were literally trying to do something else, and they're looking and they're like, did you ever get your spleen removed? I'm like, no, unless my mom didn't tell me. I'm like, no. And it's like, it just shows in different ways. People get enlarged spleen. So everybody has a different way of how it affects you. But the biggest thing is, again, going back to, not only is it an issue with the pain crisis, but the organ issue. So it causes so many other complications. And that's what people really need to understand.
Absolutely. I have a patient who is 6'5", and he looks like a basketball player.
Yeah.
He barely finished high school because he was always so sick. I have patients who are like very petite and very skinny, and they have gallbladder issues. I have people who are, overweight. So there's every color of the rainbow that is represented. There is no look to sickle cell disease. Now, when I was growing up in Nigeria, there used to be a look. The look was, you're malnourished, you're very sick with a pot belly, and your eyes are yellow.
Yeah.
Like not anymore how sickle cell presents. Even in third world countries, everybody has like decent food to eat right now. And so most of the time, but it's no longer like you're malnourished and then that's how sickle cell shows up. It's like you have a blood problem that affects every organ, and you may grow to be 7 feet tall, you may be 4 feet tall, you may be 5 feet tall, you may be dark skinned, light skinned, you may be Caucasian, you may be Indian, you may be Hispanic.
Yeah.
It's a very diverse disease, and it affects a very diverse population in very different ways. And you may have one issue when you're younger, and when you're 40, there's a totally different issue that you have.
Like that goes back to my brother. We had him on as a guest earlier this year, and so actually in July. So he was talking, my brother, when we were growing up, he never really had any complications. It was always me and my sister. And then now in his 30s, he ended up having a stroke. And so it's just like, it didn't really affect him as we were growing up. I never saw him really get sick. And if he did, he always was like, oh, I have a Charlie horse. It wasn't that bad. And so his wife would be like, a Charlie horse doesn't put you in the hospital, but okay. So it wasn't to the extent of it being a really big thing for him until he had the stroke. He has 2 kids, really started to see like, I need to take this seriously, because he passed out at work. And so it changes as you grow. And then it goes back again to really knowing that sickle cell isn't also something that just affects children. It affects adults as well. And so we need to keep that same level of care as you grow through your life. And as we continue to move with patients, just like how you said, you have your patient that's 75 years old. And so we continue to have that same level of care for people from childhood to adulthood, then we can try to elongate the lives of those living with the illness.
Absolutely.
Yeah. Well, I want to go to something, because I feel like, Dr. Ify, you spoke to the name of the podcast, right? So we named this podcast Silent because I guess there are 2 parts to it. One, because this is a disease it's kind of silent, because you look at someone, you can't tell that they have sickle cell, right? The other side of it, which I'm curious about with you in medicine, is about how it got me thinking about how sickle cell patients are silenced, especially in the medicine field when they go in, because they don't necessarily look like they're in pain. And it's really hard to tell. Can you tell us a little bit more about like how that shows up in medicine and what you do as an advocate to address it?
I cause a lot of good trouble.
I love that. I love that.
Talk about silence. So when you have cancer and you start getting treatment, you lose your hair. It's very visible. Everybody, I don't care if you're educated or not educated, when they see a bald-headed person, they know, oh, they have cancer. And oh my God, you have this natural empathy towards somebody with cancer. You think, oh my God, it's gonna kill them. Let's be nice to them. Let's help them out. But unfortunately, there's no look to sickle cell disease. There is no look to pain. When a child has their first pain crisis, they may cry a lot. But when you get to Ijeoma's age, and you're like, I've had this over and over again. If I'm hollering and crying all the time, I'm gonna hurt myself. So you kind of learn how to manage the pain, but it doesn't mean that you don't have the pain.
Yeah.
Right.
How to manage feeling tired and weak and fatigued and just not yourself. But it doesn't mean that you don't have those symptoms. So when you talk about silence, because you have to cope with living with this condition, you learn to adapt to it, but that doesn't mean that the symptoms are not there. And I think a lot of times in healthcare, if we don't see swelling, if we don't see have a big rash, or if we don't see blood coming out of your eyeballs or your ears or bald head, we automatically assume that it's not that serious. You know, and so people think, okay, when you're having a heart attack, you're going to show up as a certain kind of way. But what happens with Black people, when they have a heart attack, they feel like they have gas. And they have a heart attack and then they die, right? If you have a car accident and you're bleeding, everybody rushes to your side to save your life. But with the sickle cell crisis, even though you may more likely die from a sickle cell crisis in your lungs, acute chest syndrome, than from a car accident because you're bleeding, people are more used to attending to the visible symptoms of a broken bone sticking out of your body, as opposed to the bone that is cracked, painful in your body that you can't see from a bone infarct from sickle cell crisis. So we're as human beings, that's a disparity right there. That's like it's like a disparity. So it's not equal.
Yeah.
Pay attention to things that are not very visible, which is a challenge because the invisible things that happen to sickle cell disease are deadly.
Yes.
If I don't look in your eye, I may not know that you may go blind tomorrow. I had a 26-year-old young who he hadn't been to the eye doctor. He never had any problems. And then one day he was like on the potty trying to get the poop out, and then he went blind. Literally.
Oh, wow.
Now this boy played football in high school, and now he has a cane and the dark glasses and cannot see because it's not visible.
Yeah.
Invisible thing. And there's a lot of that going around that I want to encourage providers. In sickle cell disease, I say something about look for the needle in the haystack. Go look for problems. Because if you don't look for the problem, by the time you find them, they've caused so much damage, it may be too late to help the patient. If you wait for them to have a visible problem, when their body is all swollen, by then they're on dialysis. So the kidney issues 5 years ago by looking for kidney problems. You have picked up the risk of stroke 5-10 years ago by looking for the risk of stroke, as opposed to waiting for them to have a stroke before you do something about it. So you're absolutely right, Christina. It's there's a lot about sickle cell disease that is not just invisible from the physical, but it's also invisible from what we need for the patient. So insurance coverage, medication coverage, job accommodations, school accommodations, they look like they're fine. So why do they need an IEP? Why do they be able to go to the bathroom every hour when they're at work? Why do they have to have a temperature controlled office? Because these things, if they don't have it, will cause invisible complications in these patients. But
that's really good.
Kind of reminds me of, the recent article that was put out by CNN that Black African-American mothers are more likely to die during childbirth when taken care of by a Caucasian doctor. And so I feel like that can also apply when it comes to sickle cell patients, because it's like you really don't have an understanding of what it is in order to try to treat them. And so I'll even just go into, like when you spoke about insurance. And so being at my age, I'm looking at trying to freeze my eggs, right? And that's one of the things I'm trying to consider, just being transparent, because I'm not in any rush to try to get married anytime soon, but I want to be able to know like it's there just in case, so that it's in the background, right? And so I have coworkers that actually went through the process. They're married. And so they went through the full in vitro process. And my job, the insurance covered it 100% because they went through in vitro. So I'm not married. I don't have a husband, so I'm not going to go through the food process. I just want to go through half of it, get the eggs out, and then I'll pay for the other part to get it frozen. So I'm still going through the process. They said the only way they will pay for it if I was a cancer patient. And so I'm just like, how does it like, and then my hematologist wrote a letter to let them know like why it would be beneficial for me to freeze my eggs at this time or whatever in my life. And so like, even with that background, the hematologist, the same hematologist that would write the letter for the individual who has cancer, you would approve that. But the same issue that I have, because they're very similar in terms of the medication that somebody in sickle cell has to have and the medication that somebody that has cancer has to have, they're very similar, right? And so you're like, okay, if this cancer patient is going through chemo, they can take it. But if I'm going through, you know what I mean, the medications that I had to take for a sickle cell, I can't, you're not going to cover me. And it's like, why? Because you don't understand it.
They do, and that's the silent thing. And that's why podcasts are important, to raise awareness. And it's not just to let people know that sickle cell disease is there, but to let them know that when you make decisions and you make policies and rules that affect the general population, remember that there's people who fit different buckets that you got to.
That's right.
Think about, you know, bathrooms for women versus men, right? If you have a policy for medication coverage, sickle cell is one bucket of patients and then cancer is another. But there should be equality and parity for how you provide support for every patient.
Exactly.
Just some. And it's really because of people are aware about, I mean, everybody knows about cancer. You have a bald head, even if you shaved it yourself, they're like, you have cancer? Oh. And I'm like, no, I just cut my hair. I don't have cancer, you know.
Yeah.
Understand that there is that invisibility, and they have to think really hard about how is this policy going to affect this group of patients, and how can I make sure that we have equality in everything that we do. A really good example.
And so it's like, it's not to lessen one disease versus another. Everybody needs help, right? You know what I mean? Like, cancer is just as a thing that affects so many of us in this world. And so then same thing, like we were talking to one of our first guests, and it was like how whenever you do research, it still says 100,000 people worldwide have sickle cell disease. That number has not changed since because nobody is updating the information. And now they say it's like over 100,000, right? And so it's like, you really don't know what the true number of people, because how many people have been born since that fact was put out in the world? And so
10 years ago,
like,
right?
Exactly. So it's just like, we need to do a better job of taking the time to look at all of these rare diseases, you know, not just sickle cell, other rare diseases out there as well, and giving them the same type of attention. Because everybody, I mean, like, it just goes back even with us talking about this whole thing of Black Lives Matter. And we talk about like all of the stuff that's happening right now with the disparities and all of the injustice that's happening around the US. And it's like, these are things that we need to consider. So like, things that affect people that are in the minority aren't taken as seriously. And we really need to look into that.
Part of it, Ijeoma, is that people don't understand. So when we go to medical school, we are taught based on the majority, right? Medicine is designed based on the majority. So you mentioned about if you have a baby, if the Black woman is more likely to die in childbirth, taken care of by a white physician. I want to kind of segue to an example in sickle cell disease, right? Think about the Black male with sickle cell disease, who's having a pain crisis or priapism when they have a sickle cell crisis in their penis. When they show up to the clinic or the ER, do you think they're going to say, hey, look at me, my penis is hurting, right?
They're not.
I'm in pain. Or more likely than not, they're going to come in there looking like they're mad. the cultural expression of pain and distress is very different in Black people than in non-Black people.
Yeah.
The cultural expression of a Hispanic person in pain is also very different than in a Black person in pain. If you don't know that, it would affect the way you take care of your patient.
Yeah.
So when I see a Black patient who says, I'm fine, I let them say they're fine. And then I'm like, okay, so do you have a son? What do you do every day? You know, and then after they start talking about how they can't go to work, and then they start to crying, then I get the real story. But if I just take that first 5-minute story, I'm great, I'm good. And I used to do that. And then they leave my clinic and they go straight to the emergency room. And I go, what did I do wrong? Why didn't I know that they were in this much pain? They looked like they were fine. But they're not gonna just, oh, I'm hurting. No, Black men are very stoic. They're they internalize their emotions and their feelings and their pain. And you have to give them the space and the grace to get to be comfortable enough to kind of tell you that they're in distress.
Yes.
It's really tough to see a Black guy rolling on the floor screaming in pain. I have never seen that, right?
That goes back to my twin brother. Like,
in a crisis, they will not let you see it. That's just how we're raised. We're raised to be, you know, Black women are the same thing. Men, patients, I'm fine.
Yeah.
They're just mad.
I'm guilty of it.
You know,
I'm very guilty of it. My friends, they'll call me and I'll be in the hospital and they're like, Ijeoma, like, why didn't you tell me you were in the hospital? Or why didn't you tell me that I'm like, I'm good. Like, don't worry about it.
But she's not.
Like,
known her long enough. But, think about the ER doctor. They don't know you.
I don't know.
Yeah.
Like, okay, the pain, she doesn't look like she's a 10 over 10 pain. She says it's 10 over 10, but, she doesn't look it. So let's just let her go home. But if somebody who knows you, they can look at you and they can say, you know what? She normally is happy, smiling, and right now her face is kind of flat. This is not herself. I had a patient who went to the ER in a different state and they called me and they said, oh, he looks okay. So I did a face video visit with him and I'm talking to him and I'm like, he is not giving it back to me like we normally banter in clinic. Something is. And I said to the doctor, scan his brain. Something is wrong. He said, but he looks okay. I said, no. I've known him for 5 years. When I talk to him about stuff, he normally gives it right back at me. And his response time is much slower, way slow. I am worried that he's having a stroke.
Yeah.
And to the fact, when they scanned his brain, he was having a stroke. There was nothing in his exam that pointed to that, but just knowing that his normal way of interacting with me was completely off was how I figured it out. But if you don't know the person and you just assume that everybody presents the same, you will miss that critical information. Again, that's about the silence of sickle cell disease. We have to know that silence doesn't mean that it's not there. We got to go look for what we're trying to find, right? Go look for it. Look for, is he in pain? What's going on behind that anger, that flat look, that I'm fine, that I'm on my phone, ignoring the doctor? It's not because they're not in pain. He's trying to control himself from lashing out. That's why we're distracted. We kind of rock, they kind of, go back and forth. You think they're not listening to you. They rub their knees all the time, even though their back is hurting, but they're rubbing their knees. You kind of learn the different mannerisms that tell you the story of what's happening that they may not say in words. And I've learned to speak that language, but it's taken me 20-something years to do that, right? But again, we got to talk about it because people can learn the language if they want to.
Yeah.
Yes. And that's what I was just now thinking about. Like Ijeoma said about 10 minutes ago that we need more doctors like you. Like we legit need more doctors like you. And and when I say like you, I mean people who stop to look at people as human beings and get to understand what's going on with them. And then I started thinking like, we don't just need doctors like you, right? We need everybody, right? We need police officers like you, right? Because it's like what I'm seeing, what I'm experiencing is, obviously you're specific to sickle cell and you're a doctor, but like outside of that, you have taken time to look at people as humans and understand what they need and get to like know on a deeper level. And I think that a lot of that empathy in service roles is missing. People who are supposed to serve us, or service the public should be the people who are really practicing empathy. And it doesn't always happen all the time. So like My God, we seriously, we need more doctors like you.
Part of it, Christina, is that we're scared.
Yeah.
So doing this type of empathetic work comes at a cost. It comes at a cost to the doctor, and it comes at a cost to the healthcare system as a whole. It takes time, and time doesn't equate to money in healthcare.
That's right, yeah.
Time is money in business, but time is not money in healthcare. The longer I spend with one patient, the less money they make.
Exactly.
Right.
But then it also is a cost to me as an individual. So I have to be able to be okay with letting myself experience your pain.
Exactly. And everybody can't do that.
Everybody can do that.
Exactly.
You may be a doctor, but you may not be able to handle facing that person's distress.
Yeah.
Right? Or letting them see that you see. So I have a friend who's a doctor, great guy, wonderful guy. And one day we were working, and he started yelling at me. And I was like, "Fuck this dude." I'm like, "Look, what's wrong with you?" And somebody saw him and then reported him to the boss. Because, we have a code of conduct. You can't be yelling at people in the middle of the hallway, whatever. I mean, I'm from New York. I can handle it, right? I'm good. But the person who saw him was highly upset. He was in the South. If it was in New York, people don't care. But in the South, it was in Georgia. They were like, "Oh my God, he's yelling at another doctor. That's unacceptable." They ran to the boss and they reported him. So, the boss called him in. I don't know what they said. I saw him a few days later. He said, "Ify, I just want to talk to you that, that day he had 3 patients who were dying. One was a big kid, like a little 6-year-old, a 13-year-old, and then a 20-something-year-old. And he said that he just was at the point where he just couldn't handle it. And he said, sorry for letting his emotions get on me, but he wasn't mad at me. He was just mad at the situation that was going on." And so I respected him for that. But that's the cost. When we see people who are sick all the time, we have to put up a wall so that we don't get to the point where we can't handle it anymore.
Yeah.
I leave you and go to the next person, then go to the next one, and go to the next one. So people don't even think about that. The burnout factor for the healthcare provider is hard.
Yeah.
And you have to have enough space for that. And then you don't want me to kind of learn how you respond to pain, and you want me to learn how Black people respond when they're mad. Like it's a lot to explain to people, but it's something that has to be done. So I say, you know what, I want to do this because I want to be this type of doctor. This is how I want to do my own practice of medicine. That's my choice, which means that I have to decide how am I going to cope with letting myself be that empathetic. So I'm going to say it on the podcast, let everybody hear. I have a therapist.
#therapy. I knew it. I knew you were going to say
therapist
that.
this morning.
I got my seat on the couch because I can't do this the way I want to do this if I don't have somebody helping me to be resilient and to stay strong and to keep on doing it. And it's not something that is very common amongst healthcare people to be vulnerable enough to go to therapy. I'm not crazy. I don't have anger issues. We all have a little bit of crazy and a little bit of anger issues in us. Everybody does.
Yeah. We sure do.
The doctors do, the nurses do. Shoot, my children and my husband does. So we all need help. But you have to recognize that you need that, because if you don't, you're going to do a really good job for like maybe 5, 10, 15 years. You're going to hit that wall and you're going to be a different kind of doctor than you plan to be.
Yeah.
A different kind of nurse than you plan to be. So people who kind of spend the time to refill their tank and come up with a way of having that reserve to keep on giving and giving and giving, then you can say, you know what, I did what I needed to do. And then there's going to be times that, you know what, I need to step away.
Yeah.
Like last year, between December and January, I disappeared.
Yeah.
I was like, I can't do this right now. Peace out, y'all. I'll come back in 2 months.
Yeah.
And so you have to kind of know when to refuel, refresh, and then come back.
Because I can even tell you, because I've anybody that knows me knows that I'm an empathetic person. It's like I take on other people's stuff, and it's like I want to be there to help whoever and whatever I can. And so how you said we all need therapy, right? And so Black girl therapy. So I'm an advocate for that. So I was talking to my therapist today, and so she like, Ijeoma, you got it all together. Like you're good. You got everything organized. Like you have all your ducks in a row. But with everything that you're doing and everything that you're doing to help everybody else, where's the time that you made for yourself? And so that's right. So she's like, okay, you did all this, but then, okay, where's your time? I'm just like, you're right. Like I had no answer for her. I was like, you're right. I do need to take that time, but it's like, it's true. So it's like, you're so open to absorbing. And so it's like you take on everybody else's pain,
Yeah.
everybody else's issues. You try to be helpful for everybody else, but then it's just like you don't really get that in return. On the other side, it's not necessarily that people don't want to, but it's just like people don't do it to the level that you do.
Yeah.
And so because of that, you end up also like keeping those things in for yourself. And then when it gets, when it gets to it, it's like, okay, I need a break. And so just recognizing and understanding when you need a break and when you need to take time for yourself to refuel and have that self-care. So we all need it.
We all do. And the patients need it. The people living with sickle cell disease, I don't want to use patients on a public because they're not my patients. People living with sickle cell disease need it. The people who take care of the people with sickle cell disease, the family members, they need it. And then the healthcare people, they need it as well. We sometimes are a little bit more arrogant and we think that we don't need it because we have all the medical knowledge.
Yeah.
But at the end of being a doctor, you're also a person.
That's right. Yeah.
Wife, a cousin, a sister, a daughter, and so you need to not just have medicine, but also be able to enjoy your day-to-day stuff. And I want to ask the sickle cell community, have grace on people like us.
Yeah.
We're not going to get it right all the time. We're going to mess it up half of the time. We mean well, and we need you to teach us. Don't get tired of teaching us. Don't get tired of correcting us or feeding us with information. Don't say, you know what, I'm going to not come back to healthcare because they made me mad. Don't do that, because you're not helping you or the people coming after you. And you're not helping us. You got to try. You got to keep on keeping on. I had to call the doctor one time to get an appointment. And the way the lady answered the phone, I said, so if my patient calls you, is this how you're going to answer the phone to her? Right. And I said, first of all, I'm not mad. She said, I know you're frustrated. I said, I'm not frustrated. I'm not mad. I just said, but I want to let you know that this is not how we're supposed to do.
Yeah.
If you're calling me and I'm the patient, you need to be nice to me and make me feel good about myself and about the call. If your phone call is giving me anxiety and stress, then something is wrong.
Yeah.
And so I went to her manager, not to complain about her, but to say the process has to improve.
Yeah.
That's more work than I needed to be involved in that day, but it took me another 1 hour. But I wanted to make sure that if my patient calls that same number, they're not going to get that kind of attitude on the phone.
Yeah.
But it should be done in every environment. So if we do something wrong, don't get mad and just leave us alone.
Yeah.
Get mad, get over being mad, and then find a way to help correct us in a way that either makes it better for you or for the person who's going to come after you. Mm-hmm. Because if you just leave us to be bad in our badness, it would never get better.
Yeah.
We will never learn. And we may not want to hear it right there and then, but after a couple of times, they're going to get it. We will improve. I think overall, people want to do a good job.
Yeah.
But if you don't confront the negativity and the bad behavior, then it's never going to change. It's like the whole Black Lives Matter thing. If we don't talk about racism in America, then we will never end racism in America.
Yeah.
If I get mad because somebody was racist towards me and I just keep it to myself, it's never going to change. They never know that they're being racist.
Yeah.
They may not know. So we have a duty to kind of help change the narrative by talking about it, speaking about it, confronting it, addressing it, not by being angry or being aggressive, but cause a little bit of good trouble.
Yeah. And so just even the way that you said that, in terms of taking the time to do things and to educate. I know like people say like, I'm tired, just like how you brought back the Black Lives Matter thing. It's like, I'm tired of having to tell people how to treat me. I'm tired of having to tell, you can say that too with the cell thing. It's like, but at the same time, it's like, we have to be our own advocates.
Yeah.
And the way to be an advocate is to educate. Yeah. And so I get it, and from the perspective of being tired, but we need to continue to do the work in order to make that change and then to see that difference. Just like how you said, you've seen a change from the 80s, the 90s, the 2000s up into now 2020. Yep. So we continue to take that time in order to let people know what the issue is, what the problems are, being able to really see those different things that have been going on and take action, then there will be change. Yeah. And so we really just need to just have hope and just stay strong from that perspective. Mm-hmm. And so I would say, what are some of the things that you're excited about that you see happening in the sickle cell community?
Yeah.
So the one thing I'm most excited about is that people with sickle cell disease are speaking up more. They're talking, they're blogging, they're podcasting, they're giving talks, they're at conferences, they're engaging actively in a discussion about what happens to them. That to me is the best thing that has ever happened. When I began my career, I never saw a patient in any of these domains.
Yeah.
It was always the doctors talking, and they didn't want to hear from us. The government doesn't want to hear from the doctor.
Yeah.
The insurance company doesn't want to hear from the doctor. The pharmacy doesn't want to hear from the doctor. They want to hear from the people who are affected. So unless I have sickle cell disease as a doctor, I'm not as effective a voice as somebody with sickle cell disease talking about what affects them.
Yeah.
And I've challenged my colleagues who work in pharmaceutical companies and different insurance companies and other service organizations, go and hear from the people who are living with sickle cell disease. I can say it.
Yeah.
I'm going to say from what I heard from them or what I know from a medical textbook. But you will not get the full story unless you hear from the person who is involved. So we did a survey called the SWAY survey. It's an international survey of sickle cell disease and sickle cell providers. And we looked at 2,100 patients. And we asked them, how does sickle cell disease affect you? And let me tell you, they told us. They told us that they miss at least 1 week of work every month because of sickle cell disease. Now, I would never have thought it was that bad. I'm a doctor.
Yeah.
But the patients are telling me that they miss work, they can't take care of their children, they can't finish school, they don't get paid well because they can't get to high-paying jobs. I mean, the data was unbelievable, right? And so I would like people to kind of go on LinkedIn and look at the SWAY survey. It just shows you how impactful sickle cell disease is to people who are affected by sickle cell disease. But we want to hear from the patient. Not the doctors and not other people, but from the patients themselves.
Yeah.
And it's amazing how much pain they have, how much disability they have, how many times they have to have surgery, right? How much they have to take pain medication, how they're afraid of the pain medication, how they want to take hydroxyurea, but they're afraid of the side effects of hydroxyurea, how they wish there was something better, how nobody tells them about what they can do to stay healthy. I mean, we were ashamed of how horrible we've done with educating and providing support and treatment for sickle cell disease. But we needed to hear from the patient population.
Yeah.
Because
Can you spell
SWAY?
SWA?
AY.
SWAY, okay.
SWAY.
Yeah.
So World Assessment Survey, SWAY, SWAY.
Okay.
Okay.
And so just even with what you brought up in terms of the patient being the advocate and the patient speaking up for themselves, I feel like exactly what you said, it's very important, because I am one of those people that didn't talk about it. And like now that I have become open and become more of an advocate and being able to see like there is no like one face to sickle cell, I've been getting people that are reaching out to me and saying like, oh, like I have a friend, you know, that had sickle cell, and, you know, how they want to be involved and how they need, you know, I mean, when they help. And then on top of that, the thing is that from the perspective of even with this whole podcast with the Revolve, it's like we want to inspire and encourage those individuals that are living with sickle cell. And so just one of the things that you said about like not being able to get certain jobs because they feel like they're, you know, I mean, because of their illness or because of their sickness. I want to be able to come out here and show like you can, you know what I'm saying? Like you can still be successful. You can reach your highest potential. You can achieve your goals, even with sickle cell. And see, I'm one of those people, you know what I mean, to be able to show you that it is possible. And so with that, being able to bring other people around to show like it is possible for you to do these things. And so if more people speak up and if more people have a voice within this and they're not scared to show, because that's the thing, it goes back to what we said about the silence. It's like, I don't want people to see me from a position of weakness. I don't want people to see me as less than, because I have this illness that people don't understand and that people feel as a death sentence, or people feel like I'm supposed to be, like you said, like back in the day with the big belly and malnourished and all of this, that's what the face looked like. Because back even when I lived in Gabon, that was one of the things because that's when I was planning the Ruby Ball, it was like, oh, you don't look like you have sickle cell. Like I would never thought, because of the way that it's being treated out there. It's like there is more of a look over there than it is out here. And so just being able to come together, be that voice, giving other people encouragement so that they're open to like, okay, I'm fine speaking about it. I can get up and I can share my story as well, so that I can encourage and I can uplift others around me.
And educate us.
Yes.
I learned from one of my friends who has sickle cell disease, who also is my coworker. She's 64 years old. And she taught me, okay, I've been doing sickle cell disease for a long time. I have all these degrees. She said, Ify, when I go to the bathroom, I wake up in the morning, I put the heater on in the bathroom. Once the bathroom is all nice and toasty, I go take a shower. And I stay in there in the nice toasty bathroom to kind of get lotioned up and dressed. That I learned that because normally I'll go take a shower. When I come out of the shower to the cold bathroom, I have a pain crisis. I never thought about that. So her teaching me has made me teach my patients about how they don't have to have that morning pain crisis that makes them not able to go to work. You know, I learned from a patient about, she said that everywhere she goes, she has a bag. It has a hat, gloves, a scarf, and a water bottle. Every purse she carries. Because you come to work every day and you think it's summer outside.
Yes.
It's like minus 25 degrees.
My job, the people in my office used to make fun of me because I have a winter, when we were back in the office, I have a winter coat that stays at my desk and a blanket. And they're like, Ijeoma, what is wrong with you? It's not that cold. And I'm like, y'all don't understand. And it's like, I'm not going to sit and let everybody know in the office that I have sickle cell because they don't understand. It's just like, I get cold easily. But that's part of it. It's like, I don't want to get to a point where, because I remember I was at a conference one year in Arizona. In Arizona, it's the desert. It's hot. But in the hotel, when we were in the conference, it was freezing cold. I was walking back to my hotel room and I had a crisis from the conference room, walking back to my hotel room. And literally they had to carry me. The hotel staff had to carry me back up to my room. And I had to call my hematologist back in Houston because it was that bad. But it was just because of how extremely cold it was in that conference room to me coming outside that caused me to have a crisis. And so people don't understand it can be that quick.
But not just patients don't understand, the doctors don't understand. So providers don't know, the nurses have no idea. Like they don't know. So if you don't talk about it, how will we know? Right? We will not know how to help you if we don't know that this is something that can actually happen to you. Many don't know about the whole swimming pool thing. You go to the pool, you're nice and fine, and you come out of the pool and then you want to sunbathe and then boom, you got a pain crisis. So the guys with dreads or the women with braids, you come out of the pool, hair's all wet, you dry up, but you have the wet water dripping down your back, then you got a pain crisis on your back. I found that out from my patients. I had no textbook will teach you that. Or they'll tell you how when they get married after the wedding, they got a pain crisis because of all the excitement. You know, we forget that good stress and bad stress can trigger sickle cell crisis. You know, and changing temperature, we know about that. I learned about the whole, if you have a tooth abscess, that can be where you end up with a full-blown body pain crisis.
Because of the infection.
You know, it's not in any textbook. We are learning that because we hear from y'all, and then we begin to look a little bit closer, then we hear from y'all, then we kind of look. But the more you speak about it, the more you talk about it, the more you engage in that dialogue, the better we will be as your providers. And then the more we can get other people to understand what's going on.
And you touched on like the different things that causes sickle cell crisis. So if you could speak to that and just name what those things are. Triggers. I know there's about 5 of them. If you could name that so that people have an understanding of that as well.
So what is sickle cell crisis? The first thing is dehydration. And I have a couple of things that I kind of talk about with dehydration. Number one, you got to drink a lot of water, okay? Because in sickle cell, the kidneys tend to be water leaky. They leak a lot of water. So if you drink a cup of water and I drink a cup of water, Ijeoma, and we go pee, you're going to pee 2 cups and I'm going to pee 1 cup. But the sickle cell person is more prone to dehydration than everybody else. So you got to drink a lot of water. So things that can cause dehydration is things like coffee, alcohol. Now, the thing about alcohol is if you drink on Friday, you will not have a pain crisis on Friday. You're going to have a Monday morning or a Monday night or Tuesday morning pain crisis. It's not going to even remember that you had alcohol on Friday because it takes about 2 or 3 days, right? And then you come in and you're completely dry, pain crisis. Infection, so a sinus infection, dental infection, a urinary tract infection, STD, the clap.
Any type of infection.
Let them cover it up, women. Make sure that everything is covered. Pain crisis.
I love Dr. Ify.
Altitude.
Real. That's why we have to put you on this podcast. You let them know all the facts. You keep it 100%, and we love you for that. But yeah, no, it's true. The infections.
Infection.
And continue.
Any kind of breathing problem where you have low oxygen, so asthma, smoking. I don't care what you smoke, whether it's cigarettes, marijuana,
marijuana.
black and mild. I had a patient who said, "Doctor, if I don't smoke, I don't take black and mild." I'm like, "What's the difference?" Okay. It steals oxygen from your lungs, and it makes your cells sickle. Going to a place that has very high altitude, so New Mexico, Colorado, that pressure change with the air can cause a crisis.
Colombia, because I was in Bogota and I didn't realize that I was gonna go into crisis when I was out there with a friend, and I was just like, "Oh, this altitude! I got really bad altitude sickness being there." And then, because I'm fine,
Ethiopia,
I fly out
right?
when I was in Ethiopia, I had both times. So the first time I thought it was just like a fluke. I was like, "Oh, I'm fine." The second time I was like, "Yeah, this is the altitude."
You got to watch for that. And then the other part that I talk about is overexertion. So you want to exercise. You think, okay, I'm going to go to the gym and do like a P90X all in one day. Okay, first of all, none of us can do that. It's just, you got to crawl, and then you walk, and then you run. If you go from like 0 to 100 all in one day, you're going to end up with a problem. I had one of my patients in Atlanta, when the Wii first came out, he was part of a 24-hour Wii competition.
Oh, wow.
I think it was a tennis. So he did that overnight, came into the ER, his hands were like this.
Oh my
goodness. For those of y'all that are listening via the podcast, she literally just demonstrated in terms of like a statue of how the patient
up, like he was like, hanging on a cross. He couldn't put his arms.
Yeah, like hands up, don't shoot.
The other one that I saw in Atlanta was when we first started having skinny jeans. There's something called the skinny jean syndrome. When the jeans are too tight, they cut off your circulation.
Oh, wow.
End up with pain from the waist all the way down to the ankles. The blood is not flowing. And then the last thing I want to bring up is stress. Stress. Whether it's good stress, you got married, you got engaged, you got a promotion, you got a new job, you had a baby, or bad stress. The boyfriend left you, your girlfriend is cheating on you, your baby daddy had another baby mama. I mean, all the stress. That emotional up and down can cause a lot of inflammation and a narrowing of your blood vessels, and that causes you to have a pain crisis. And so what I find as people get older is that you know how to control your dehydration. You drink more water. Yeah. You know that if you watch for infection, you can kind of prevent that, but you have to learn how to manage your stress. That becomes the biggest thing in adults. At like 25, 28, 30, 40, 50, it's life stress. The bills have to be paid. Your job is giving you stress. Your mama's getting sick and you don't have anybody to help take care of you. You have like 3 or 4 kids who are doing Zoom education right now in the pandemic. That is stressful, and that stress can make you get sick. And so learning how to manage stress is the number one skill you have to learn with sickle cell disease. And all of us should learn, because stress will make you fat, make you have a stroke, make you have high blood pressure, make you have migraine headaches, tense muscles, and it can cause a sickle cell crisis.
Yeah. No, thank you for that, Dr. Ify. That's very helpful, just from that perspective of showing like it shows in different ways. And again, with stress being one of the biggest things, because I'm not gonna lie, when I have a crisis, it's usually either from stress or dehydration. Those are my 2 main things that would cause me to go into a crisis. And so I know that we're running out of time. I wanted to just go back to those individuals that aren't necessarily, that don't have sickle cell, or that aren't a caregiver to individuals with sickle cell, but may know somebody who has sickle cell, or maybe a friend of somebody that has sickle cell. Like, what is some advice that you would give to individuals who are listening, who may not have had a understanding of what it was until now, in terms of how they can be advocates and how they can show their support?
So the first thing I would say to people who want to be advocates, or who really want to be empathetic people, is it's a condition that affects the entire body, the entire life, and everybody around that person. So extend some grace. That's the first thing. Extend some grace, be empathetic, try to understand that if you have a chronic, lifelong, painful medical condition, life is hard.
Yeah.
They're going to need some help. And it's not fair to expect them to beg for that help.
Yeah.
Because if you have cancer, which by the way, most cancers are like, you have it, or you get better or you don't. If you don't get better, you pass on and go stay with Jesus. But you have a 5-year time where you're going to be either well or not. Sickle cell disease, it's forever.
Lifelong. Yeah.
It's your whole life. It doesn't get better because you're 25 or 30. It's still there. So please understand that they may be sick on Monday in January, and then on a Friday in March, and then on a Thursday in December. It's not because, oh, you were sick last week. How are you sick again? No. It can at any time. It's unpredictable. They have no control over it. And it's lifelong. And so try to be understanding about that this is really, I mean, you want to think about your worst ever flu episode or worst ever medical issue. And if you've never been sick, go on your knees and thank the Lord Jesus for giving you health. Because it's hard to be sick. And it's even harder to be sick with sickle cell disease. And then if you have an opportunity to do anything to support sickle cell disease awareness, education, advocacy, fundraising, giving back, please do it. Because when you have a disease that is mostly in Black and brown people, there is not a lot of people out there trying to donate money, donate resources to help the people, right? And so you want to make sure that you give a little bit to help that cause. So if you are in any way you can kind of support, it may be in cash or in kind, go ahead and do that.
In blood.
Give your support. Okay, try to break it up. You can get to cancer, but get to sickle cell disease as well.
Yeah. No, thank you so much, Dr. Ify. We really appreciate your insights, your knowledge, your jokes, your everything. And so just like this whole conversation was very much needed. We thank you for everything that you're doing for the sickle cell community. We are excited to be able to just be connected with you. So we wanted to be able to also allow our listeners to be connected with you. So what is the best way for them to connect with you via social media, whatever is your...
So, okay, so I'm getting good at this. It's Ify Osunkwo MD on Twitter. Okay, it's at Ify Osunkwo MD. And then on LinkedIn, I think it's the same thing. It's whatever. It's Ify Osunkwo MD. So that's how you find me on LinkedIn and on Twitter.
Yes.
Perfect.
And so in the beginning, you shared your one word. And so definitely throughout this entire conversation, we've been able to see how that transpires in your life as an advocate for sickle cell, and like that compassion that you have for those individuals with sickle cell. So I guess just to wrap it up, bringing back the one word that you shared, how would you close that out and tie everything back together?
What did I say again? Was it mission?
Mission. It was mission.
It was mission.
Yeah.
Yes, it was my mission. I like to function with a goal. I like to follow a Northern Star. So where am I going? And my mission is that everybody with sickle cell will live to be 99 years old, lose all their teeth, and use a walker.
I love that.
I have a long way to go before that happens. So that's my mission in life. I'm close, but I have a 79-year-old, so you got 20 more years to go.
Yes.
Yes. But no, we really appreciate you.
Yeah. And one thing I heard, Dr. Ify, from you is that your goal is not to just change the one person, right? Like that phone call that you made to someone's supervisor was not just about making a difference in that one person or the next person who calls, but it was in changing a system.
Yeah.
And so we're so grateful for the work that you're doing. We really are.
This was actually a lot of fun. Thank you guys so much for having me.
No problem. Thank you for taking the time out of your day, because we see you're still in the office. So yeah, we appreciate you taking the time to connect and meet with us. We'll definitely continue to stay in contact with you. And we look forward to just what the future has to hold for sickle cell, and through your advocacy and through touching the lives of those living with sickle cell, and then also your colleagues as we continue to grow and learn. So thank you.
Thank you guys so much. It was a pleasure. You guys take care.
Awesome.